Okay, I think we're going to get going. I'm just watching the numbers roll in. So good morning and welcome everyone to the Centre for Ageing Better's webinar, The Road to Recovery, Bridging the Digital Divide. We're really pleased to have so many of you joining us for this discussion today on what for many of us is probably still a very hot morning and for some of us potentially a very rainy one. For those of you who don't know me, I am Gemma Mooland, Senior Innovation and Change Manager at the Centre for Ageing Better. And joining me this morning are Christina Leone, Senior Innovation and Change Manager at the Centre for Ageing Better, Alice Methers, Head of Research at Good Things Foundation, and Rachel Benn, Digital Inclusion Coordinator at Leeds City Council. Now, before we get started, just a couple of housekeeping notes from me. All attendees, you're all going to be muted throughout, so don't worry if your hay fever kicks in or you're still making your way through your breakfast, we won't hear you. But how we will be interacting with you today is through the Q&A function. We've had lots of questions come in advance for this webinar, which is fantastic, but I'm sure many of you will have other questions and comments that come to mind through the presentations today. So if that is the case, please do pop them in the Q&A box, not the chat function, put them in Q&A and then they'll make their way to me and I'll do my very best to get through as many questions as we possibly can do today. But of course, the discussion doesn't just have to stop in this hour of time that we have together today. You can also join the discussion on Twitter using the hashtag Road to Recovery. And today's webinar will also be recorded and made available to watch on our YouTube channel if you want to watch it back or share it with colleagues, friends, family, whoever you think may be interested. So the joys of the digital world, I think, are evident to us here right now, as I sit here being able to reach hundreds of you in one go, and with many of us only having to do about a 30-second commute from our beds to our office. And being digitally connected means we can connect with one another as friends, as families, and as colleagues. We can access entertainment, information, or vital services and amenities. And the importance of digital connection, and indeed the impact of not having that connection, has never been more evident than in recent months, I think. We've also seen some fantastic work to help those who are not online to get online, and to help those who have had no or minimal digital connectivity to get through these months of lockdown. And so today we're bringing together a really fantastic panel of speakers who are going to share with us what we can learn from the past few months about how to support people to get and stay online, and also what measures we must continue to take to avoid exacerbating inequalities between the digitally included and the digitally excluded. But before we get going and hand over to our speakers, first off, I would like you to hear from Marie and her experiences of being online through lockdown. So we're going to do the very brave thing of attempting to play a video. I'm not sure if that video is going to work. I'm going to give it 10 more seconds. Do let me know, Ellie, if it's not going to work. Don't think it's going to work. So what we'll do, we'll wrap up with Marie instead. So that's a little teaser for you all. And instead, I'm going to get started with our first speaker for today. So our first speaker is Christina. And Christina is Senior Innovation and Change Manager at the Centre for Ageing Better. And one of many hats that she wears is leading on our work on digital inclusion. And in particular, Christina looks at how we can take the research and the wealth of research that's out there around inequalities and digital inclusion and then put that into practice. So Christina's going to do a bit of the scene setting for us today. So over to you.
Well, thank you so much, Gemma. So let me just get my slides going. Ellie, if I can just share my slides, I'll get those going. There we go. Wonderful. Thank you. Thank you so much. So yes, as Gemma said, I'm going to start today by setting the scenes. Just get that. There we go. So as we know, there's been a big increase in the number of people who are online, including those aged 65 and over. And that was something that was happening even before the COVID pandemic and lockdown. But we also know that there are still many people who are offline, and the majority of them are over the age of 55. There's over 3.7 million people over this age who are not online. We know that education and income are a large indicator of who is online, as well as age, and this can further exacerbate the inequalities which are caused by the digital divide. We also know that a fifth of those not online are under the age of 50, which means that the challenges of supporting people to get online and also those who are offline will continue for years to come. However, being online has been particularly important during the pandemic and lockdown. Research by Leeds has showed just how much COVID has escalated the need for digital skills and also how vital it's been for many people. So what has been the impact on digital inclusion for people in mid to later life? We know that there have been a lot of changes. We know that it's pushed a lot of people online and also increased the number of activities that people are doing online. Research has shown that 75% of people aged 50 to 70 are saying they're making more video calls more often during lockdown, and about a third are emailing more. And Lloyds Bank found that the number of 50 to 70 or 50-year-olds that registered for online banking during lockdown tripled compared to the same time last year. And this push online has been heralded by many as a really positive thing of getting more people online, but we also know that it's created real challenges for a great number of people. Access to the internet in the home has been fundamental in our ability to stay connected, to work from home, to search for jobs, and to access services during lockdown. And yet many older people live in homes that still don't have internet access, and the cost of additional data can be prohibitive for many. In terms of looking at work, with unprecedented numbers of people unemployed due to the pandemic, being able to search for and apply for jobs online has been crucial. And yet many people over the age of 50 still rely on word of mouth and adverts to look for jobs. And those who are less digitally confident will struggle to search for and apply for jobs. Employment support has largely moved online, so those who are not online will struggle to take up this support, further causing inequality in terms of looking for jobs, but also putting them at the highest risk of losing their benefits. And Centre for Aging Better research found that while many older workers are confident using digital devices for social purposes, they're less confident in using them around work, leaving them at a disadvantage in the job market. Around health, with many people spending more time at home, many have become less physically active. And there's been a massive number of resources developed to support people to be physically active, but very few of these are available offline where it's harder to access them. The pandemic has moved more consultations with healthcare professionals to the virtual setting. But again, this excludes those who are not online. And much of the information around COVID and the guidance around COVID is largely online. So it's vitally important that the government continues to make this and the services around it available, such as through telephone. Around communities, with libraries and other sources of free Wi-Fi closed during the lockdown, many people without a device or access to the internet lost their online access. And this is especially true for people on a lower income. Some of the areas acted very quickly to get digital technology to older residents, as you're going to hear about shortly. And this helped to overcome some of the barriers of a lack of equipment, but it's been very challenging when coupled with a need to support around digital skills. And we know that there's been real challenges for people with social events, and many have moved online, but others have been very excluded from this. And also the move to online services. We know that virtual banking, shopping, and public services were already moving to online before the pandemic, but this trend has been massively accelerated. So it's very important that service providers remember the responsibility to those who are not online. So in looking at what enables and prevents people in later life from getting online, research that we conducted with Good Things Foundation found that self-efficacy, that belief of being able to be online and have the digital skills, was a really key indicator, as well as the perceived value and the relevance to people, that they felt it was important for them and worth it. The influence of family can be a big enabler and also a disabler. So an enabler where people were really supported to get online, but also for many people, their family can act as a proxy, which can make it more challenging to get online and become a real challenge if they lose that person. So from this, we looked at what were the principles to really good support for having people online. And this is, of course, central to how many providers deliver this support, but has become much more challenging to deliver when trying to do this remotely, as both Alice and Rachel will talk about. So these principles are very much around being person-centered, flexible, having ongoing support, and ensuring it's designed with those who will be using the services. So in terms of recommendations going forward, there's an urgent need to address the digital divide, which has been exacerbated by COVID-19. And that has led to countless numbers of people missing out on essential services, information, and support online. So our recommendations are for national government, local authorities, funders, and providers of online training and support, and also any businesses or organizations delivering online services. The first is making provisions available for those who are not online, ensuring the responsibility and offering offline equivalents, such as telephone. Making technology accessible so that hardware and websites are designed in an accessible way, regardless of people's age, ability, cultural background. Providing equipment and internet access so that people can access online services, and investing in digital skills in the ways that we know work. I feel there's a strong need for a central resource bank for digital champions. There's great resources out there for people and so much important research that's been done on what works. So a central hub that points out to this, especially for people who are new in providing digital support, would be key to improving this. And also integrating digital skill assessment into other support so that providers of services, such as employment support or GPs, look at assessing digital skills so that more people can be supported to get online, especially as the divide increases. Thank you.
Wonderful. Thank you, Christina. Some really useful setting of the scene there, and also seeing how some of these issues have changed and evolved through COVID-19. I've also spotted in the Q&A some requests for the slides and statistics that Christina shared, and some of the resources. We will, of course, make sure that is available after this event. So next on to Al, and Al is Head of Research at Good Things Foundation and is responsible for strategic innovation and data analysis that powers the great work that Good Things Foundation does. She's led on tons of interesting work there, most recently leading the production of the COVID-19 response report, which is definitely some recommended reading from me. So I'm going to hand over to Al, who's going to tell us a little bit more about the practice and how we can support people to get online and what we've learned through this period of lockdown.
Thanks very much, Gemma. So I'll just share my screen. So I'm really delighted to be able to talk about what we've learned particularly, and also what we've done on the ground during the last 3 months. So to give you some background, our world at Good Things Foundation and that of our community partners, our network across the UK and in Australia, looked very much like this at the beginning of March. It was full of life, it was full of people, it was full of people sharing things, making friendships, having connections. And very quickly, things changed. We just went into lockdown and it was silent. Doors were closed, tables were empty, people very quickly moved and retreated back into their homes, and we had to pivot very quickly, and all of our community partners, to understand how you could continue to provide digital inclusion support when you couldn't have the face-to-face contact that a lot of our services had at the heart of their models. One of the things that was really apparent, we held a webinar with many of our community partners early on, and it was this desire to still keep supporting people. They said people came to them and right before and said, you know, what's going to happen after this? Are you still going to be here for us? It was really hard to know what was going to happen, and it still is. One of the things we started identifying very early on through lockdown was that we were seeing 2 distinct audience groups with needs. The first group, and these are both true for older people and across all age groups in the population, were people who were digitally excluded and faced multiple issues. They were vulnerable, they were now being told to shield, and they couldn't access critical support. We also saw a new group of people coming to Good Things Foundation and coming to our learning platforms. And these were people who might be mid-career workers, might be nearing retirement, had higher digital skills. They were in work, but they'd been furloughed, and they wanted to do more. They were really motivated, and they were more educated than some of our audience who we'd seen before. So we also had to start thinking about the range and the expanding needs that we were seeing. I think there are two things that we learned very early on that were affecting older people in particular. So there was the double impact of health and isolation. People aged over 70 were being recommended to self-isolate, and this accounts for a huge proportion of the population, 8.6 million people. And there was, as Christina has said, very evident digital exclusion. People over 55 still remain less likely to be online. And this increases with age, with 51% of people aged 75 and upwards not using the internet at all through lack of access, skills, confidence and motivation. This is a really, really critical point, and it's come to the forefront during this time. I think everyone thought that we were edging towards a digitally included nation, that people had devices in their homes, that they had broadband to a greater degree than it's been revealed. There's actually a massive proportion of the population, 1.9 million households, are without access to the internet and devices. There are multiple issues, but cost is a really big problem, and we're going to see that increasingly. People are very much affected by data poverty, and we see through both Ofcom's latest releases and that of Lloyds Bank, lack of suitable devices. So only having one smartphone in the house, and therefore being able to do a limited range of activities online. So what was the impact that we were seeing? Well, people who were older and advised to self-isolate were immediately removed from friends and relatives. And if you faced, if you had a digital skills gap and a digital inclusion gap on top of this, you were unable to be buying groceries online, staying in contact with relatives through video calls, and actually doing the tasks that the online population was now doing more of since lockdown. So the divide very much grew at this point. What we did very early on was came together in terms of a collective response. We're a national charity, but it's critical to have local partners who are working in neighbourhoods and communities who see people's needs on a daily basis, and also the support of national and strategic partners. And two things that I'm just going to talk about, which I think I'm most proud of and I think resonate in terms of what we've been able to have most impact around, is first the work of community organisations where they adapted to providing critical frontline support and remote delivery. And secondly, the initiative that we launched with Future.now, which was called Devices.now and is still live, which really tried to tackle the issues of lack of personal access and data and devices for people who needed them the most. At the end of my presentation, I have references that you can link through to this work, but Devices.now sought to secure a target of 10,000 devices, which we've now exceeded, and over 4,000 devices have been allocated out through our community partners to individuals. This has had massive impacts on people's lives, and the stories that we've heard in terms of even people being able to say goodbye to loved ones who they couldn't actually be in the hospital with or the room with. And secondly, the community frontline. I think the response by community organisations has been incredible. 29% of our partners, and we have about 4,000 across the UK, went straight to delivering food and medicines to people self-isolating. 64% made emotional support calls, and 71% provided advice. And this was particularly important if people weren't accessing this online or wanted reliable and trusted sources. What was really interesting was that 72% also continued to really ensure that digital inclusion was the mainstay of their models. And so they continued to help people get online and remain online. They did this not in group sessions, they did this over hours on a one-to-one basis, over the telephone, sitting on people's doorsteps, talking through windows, because it was really, really critical. And it also meant that it helped people who needed to continue to work and needed to now do that remotely. I wanted just to highlight a couple of our partners and how this innovation has actually happened on the ground. So Age UK and Gateshead shifted to online delivery and continued to support their learners with digital skills. They reach a huge number of people every week, and they provide respite and hot meals. They're now helping people with Zoom calls for GPs. They've got friendship groups. And alongside this, they're providing digital training and in-house upskilling for their staff, so that actually if we go into another period of lockdown, and localised lockdowns are happening all the time, they're still able to be active and supporting people. The Disability Resource Centre in Birmingham cancelled all face-to-face support, but continued to deliver support through other channels like telephone and video calls. They also created helpful tips for learners, covering internet safety and recognising fraud, using Skype and ordering shopping online, so that they could stay connected and safe in a lot of different areas of life. They have also helped many people with setting up online banking, setting up bill payments, reminders through apps and calendars, so that people are in control of finances when this is a particularly stressful and worrying aspect of people's daily lives at the moment. What's also really heartening to see is that our partners have said, actually, this has been the spur for innovation that maybe they had put on the back seat because they were meeting more immediate face-to-face demands all the time. And this quote from Aspire Sussex really resonates with a lot of different partners. They say that COVID-19 has made them develop an online delivery model, made them face challenges head on, and something that they want to continue. They realise that it will make their courses more accessible in future, especially for those with different work patterns and those who are more isolated and for whom face-to-face provision is more challenging. So some final thoughts and learnings. I think personal access has come onto the agenda in a way in which it never had before. And it's not just about being offline, it's about having suitable devices, and that data poverty must be addressed. I think more than ever, it's shown that we should not leave anyone behind. COVID-19 and lockdown has unfairly affected older people who are already struggling and digitally excluded. And there's no longer any excuse for us not to act. And thirdly, just to really herald community innovation, and that partners on the front line have been able to respond to the COVID-19 crisis when they were also facing financial insecurity with speed, passion and intelligence. And that this is something that government and policymakers need to hear, that we need to sustain the innovation at a community level to be future-proof. I've just included in my presentation some links to some relevant reading, but that is me.
Wonderful. Thank you, Al. That is a huge and really interesting range of insights there. I think fantastic to see examples from up and down the country of how communities have really taken this challenge and tackled it with all the assets that they've got, and great to see some of those innovations that have come through through these recent months. So thank you very much for sharing that. And now we're actually going to focus down on one specific area within the country, and that is Leeds. So next up, we have Rachel, who is a digital inclusion coordinator for 100% Digital Leeds. Rachel works in partnership with Public Health and NHS Leeds to tackle digital inclusion across health and care in the city, supporting specifically older people and people with long-term conditions to get online. Rachel's been involved in a lot of very interesting initiatives, such as the development of a digital health hub in Leeds, and I think we're about to find out more about some of those things in her presentation. So over to you, Rachel.
Thank you, Gemma. Delighted to be here. I'll just share screen. There we go. Hi, everybody. I'm Rachel. I'm a digital inclusion coordinator at 100% Digital Leeds. We're a Leeds City Council-led movement leading digital inclusion across the city. We work with groups and organisations across Leeds, collaboratively work to improve outcomes for people through digital. 100% Digital Leeds is our ambition, but we're not enforcing digital upon 100% of people in Leeds. We'd like 100% of people in Leeds to have the opportunity to access digital, to enable them to live happier, healthier, easier lives. If people choose not to access online, That's okay, but we would like it to be an informed choice when all of the barriers to digital inclusion have been removed and they understand the benefits of being online. So why is being online important for older people? It's about inspiring them to see the benefits it can bring for them on an individual basis. For us, digital inclusion isn't about digital, it's about people. We take a strength-based collaborative approach, working across sectors in Leeds, working with organisations who have established positive relationships with people with low or no digital skills, predominantly many older people, to ensure that it's a person-centred, inclusive and very much holistic approach. It's not one size fits all. We tackle the barriers to digital inclusion with organisations who understand the needs of their service users and share best practice across the city. Our approach works to overcome the three main barriers to digital inclusion: skills, access and motivation. Enabling older people to access the internet enhances social inclusion, reductions in loneliness, increased confidence and fulfilment, maintenance of independence and associated positive health outcomes. But bearing in mind other barriers that older people face, we work with organisations to tackle these, such as having a long-term condition, going through life transitions such as bereavement, the onset of illness or impairment, increased caring responsibilities, having English as a second language, having a learning disability, living in poverty. So as the other speakers have mentioned, COVID-19 has highlighted the digital divide and increased the awareness of how many people across Leeds and the country don't have access to digital, aren't in a position to have Wi-Fi, connectivity or a device. Now I'm just going to talk through how we're tackling those three main barriers to digital inclusion in Leeds. To tackle the main barrier of access, in Leeds we've got a tablet lending scheme where we lend 4G enabled iPads to organisations who then have, through sort of COVID and the pandemic, have been distributing these to service users in isolation who don't have connectivity or any ways and means of being online, with very many kind of public buildings shutting the doors that would normally offer free Wi-Fi. This has increased massive demand through the pandemic. So working with local organisations, support them with funding bids to get their own equipment, and working with Good Things Foundation around devices.now and other amazing schemes across the country. This has increased opportunities for social connections, as well as enabling older people to boost mental well-being, which has been a really key priority through the pandemic. Care homes in Leeds have been affected massively through the pandemic and nationally. So we really took kind of a forefront role in supporting those in Leeds with digital inclusion over the last 5 months. Lending iPads and Alexas using voice technology, which have enabled residents to make video calls to friends and family, which in most cases has been a lifeline, being able to provide calls for residents that are, really coming to the last days of their life, having those meaningful conversations with family, being able to see them, which has been a real lifeline. But also having access to video appointments while they are in care homes, that's really increased. And also access to support for their mental health as well, working with Leeds Mental Wellbeing Service and the mental health courses that are available on their website. As well as supporting service users, the organisations themselves have needed support. As the pandemic kicked in sort of early March, the voluntary sector, the third sector, it wasn't ready to work remotely. So we worked cross-sector and be able to launch a COVID-19 fund, which was predominantly aimed at supporting organisations to work remotely, so they were in the best place to support their service users with their buildings being closed. We supported over 150 organisations to buy laptops, equipment, supporting staff to work remotely, being able to have telephones, mobile phones for staff so they could make those welfare calls. And it was really, really successful and really, really needed. So overcoming the barrier of motivation and skills, we work to build the community capacity, ensuring organisations have the tools, resources, skills and confidence to support and inspire their service users to go online. I thought Alice's picture really summarised that. So where that was prior to COVID, organisations having coffee mornings, having that kind of social environment for people to learn, older people sat having a cuppa and a piece of cake, you know, having to go on a sort of crossword or listening to Frank Sinatra or whatever. But as the pandemic's kicked in, that is definitely very much a challenge to be able to sort of build that community capacity, but also ensure those staff and volunteers across those organisations have the sort of ability, skills and confidence and resources to be able to support people remotely through this time where we can't sit around a table and have a cuppa. So we've been delivering digital champion training with organisations. Now, we delivered this prior to COVID. We've now adapted this and made it very relevant to the current situation, delivering it virtually, which enables organisations to tailor an approach based on their service users' needs. At the start of COVID, we produced toolkits on our website, which I'll share in the chat. We worked with specialists in areas across the city, working with service users with specific needs to really harness the resources that were accessible and inclusive for those specific demographics. For example, we worked with Leeds Deaf and Blind Society to produce some really useful and inclusive tools and accessible tools for people with visual and sensory impairments. We utilised the expertise of their organisation, who know their service users best, to provide those toolkits, and that's really helped organisations where it isn't one size fits all, actually tailoring those tools and resources and approach very much to the individual. Also, as Alice mentioned, you know, community organisations having to adapt, develop a virtual offer. This has been extremely important, where they've reduced the impact on number of welfare calls they've been making, been able to support older people to access virtual bingo, virtual coffee mornings. If we hear the video later on, Marie, who's going to be speaking, is from one of the virtual coffee mornings that we've supported set up in Leeds. And it really has been an absolute lifeline for the people of Leeds. For many, the best approach and route in is to use a hook, especially amongst older people. Rather than the thing they need to do, what about what they want to do, what they didn't know they could do, what they miss, maybe can't do anymore? Because these are the biggest drivers in turning that barrier of motivation around. What matters to that person, what would save them time, give them enjoyment. It's about making it about them, linking hooks to their hobbies and interests. In Leeds, through our digital champion training, we kind of encourage organisations to pair the familiar with the unfamiliar. So the unfamiliar, in most cases, being the device or the fact it's online. The familiar, it's possibly a jigsaw app that they know possibly how to play a jigsaw already, or a song that they find familiar, that brings back fond memories. So they can access games and apps that develop their confidence and skills, which really motivates them to see a need to go online. We produced an age-friendly app list. Again, I'll share that as well. We produced that through a project we worked on for people living with dementia and their carers with the Good Things Foundation last year. That app list was brilliant. It was tried and tested, co-created with older people themselves, which I feel is very vital. When we are talking about working with older people, it's very much having them at the forefront of user design and co-creating resources that actually, you know, work for their needs. So that was brilliant. It kind of gave apps that didn't have in-app purchases, adverts, you know, apps that are inaccessible. There's thousands of solitaire apps, but every time you go onto them, there's an advert that pops up, which is really inaccessible. So it was finding apps that would really benefit older people that don't have those barriers attached to them. So there's still challenges, very much new challenges through COVID, having enough devices and connectivity, having the capacity to provide digital support remotely and engaging and motivating older people via a telephone call, very much at the moment, remotely. Prior to COVID, obviously it was very informal, you know, sat around a table like I mentioned, but now we are finding it challenging and really coming up with ideas and new resources to support volunteers that are providing the welfare calls and that remote support through the telephone. And I just thought these two quotes, these are from service users across our community organisations, just really highlighted some of the impact of the work over the last 5 months in Leeds. And I just thought the first quote really kind of sat with me, and very much really, really interesting, kind of from an opinion of the older people that we've been chatting to, that prior to COVID, many said, well, I was isolated anyway. I mean, last winter, when I pulled the blind down at 6 o'clock, there was nothing for me, virtually. I wasn't going to a community centre at 8 o'clock. But now these virtual sessions, services have adapted to virtual. It's provided them with an alternative route of social connections and benefits. And I think that's really key when we talk about the sort of impact and possibly even the legacy of the current situation, how we've adapted, actually, that these virtual sessions could continue and support older people through the winter ahead. Thank you. I appreciate that was a whistle-stop journey through our approach in Leeds. Happy to answer questions, and do get in touch if you'd like to find out any more. And we're really, really keen to hear and listen and chat to other organisations across the country as well, because I think collaboratively we have a sort of a stronger approach to be able to tackle these barriers that I've mentioned. So really keen to work with other organisations tackling the same barriers. Thank you.
Thank you so much, Rachel. That was an incredible amount of information to get through in such a short amount of time, and great to see sort of tackling issues across the spectrum, from access to accessibility to digital inclusion. I've seen a lot of questions come in specifically for you, Rachel, to find out more about your work. So I'd encourage all attendees actually who have questions for Rachel. She shared her contact details. Slides will be available after today's event that do pick up that conversation, because I know Leeds are more than happy to share more information about the fantastic work that they've done. So we can all go away and nick it and do it ourselves, which is the beautiful thing about sharing best practice with one another. So we are now at the point of today's webinar where we can move into some question and answers. I think you can probably all see that we've currently got 50 questions and answers that have come through just from today's discussion, and then we've had a heap come through in advance. So we're going to do our very best to get through as many as we possibly can. And I'm going to start off with a nice easy one for the panelists, which is about how can we deliver good digital inclusion services at a local level when budgets are so at stretch within local and regional authorities. So what can we do to deliver this work in a really cost-effective way locally? I think I'm going to put that first over to Alice and Rachel. Who'd like to go first?
I can, yeah,
Rachel,
from I suppose a local perspective. Yeah, I think a couple of things. I think it's a really key point. I've seen a lot of webinars recently, and this is a really keen topic at the moment, I think, if we're sort of thinking going forward. A couple of things really, I suppose, looking at sort of the Leeds approach. We have a team that's coordinating digital inclusion in the city, so I think that's really key, to have that kind of strategic kind of role in coordinating an approach. But what's really interesting is our team aren't funded all through one particular funding pot. We're all funded through different sectors across the city. And I think that's really key as well, getting all parties across the city round the table to really invest funding. So that funding doesn't come from one stream, actually, just the council. Actually, that we've got our local NHS very much invested in it, because they can see the benefits that they're getting out of it for their patients working across primary care. And third sector as well, really investing in the third sector, because when we talk about building the community capacity, I think it's really key to ensure that there is people that have got those trusted relationships in those communities. So I think it's collaboration, but also ensuring that it's a cross-sector, kind of cross-sector funded, I suppose, approach, rather than just looking to one particular organisation or the council, local authority to fund it. I think it's getting all those stakeholders on board, because equally they've all got shared priorities and shared kind of hand in the agenda of digital inclusion as well. And I think very much looking at what community assets are already available. So not reinventing the wheel. So actually a lot of work we're doing, obviously working with community organisations, actually working with social prescribing teams that are already in those communities, working with community builders, link workers, that have got that asset building experience, rather than us as a digital inclusion team actually starting that as a project. I think it's really harnessing and doing that really key mapping and of data and of kind of community capacity before kind of decision making, I suppose.
Brilliant. Thanks, Rachel. So the importance of collaboration there and building on the assets that we've already got locally. Any other panelists like to add any further ideas?
I think it's also that people now realise that digital exclusion isn't something separate. It has huge implications across all areas of life. It's important in terms of, like, as Rachel was saying, health and housing. It's important it's critical in terms of education, lifelong learning. And I think there's something about harnessing the fact that you can do more if you see it as a part of all of those different areas of life. And as Rachel was saying, then actually pooling the interest and saying that actually you can amplify the impact in all of those areas. People can have, more secure homes and really like where they're living. As a result, they can be better in control of their health and self-manage. They can feel more connected to their community. They can access more educational opportunities. And it's about getting people who understand that actually putting that into those services is really, really critical.
Brilliant, thank you. So that embedding of digital within the wider services and agendas is really, really vital. Excellent. I've had a very helpful reminder from an attendee, if we can keep our answers short and sharp so we can get through as many questions as possible. And one that's come through today, actually, and a couple of people have asked this, how do we train the trainers effectively? So Christina shared some best practice principles about how we provide digital inclusion support. Obviously, it's also very much the part of what Good Things Foundation does. Also recognising that often people who are providing that support might be frontline people in community organisations who themselves might not have, massive confidence in digital skills or be experienced trainers of digital skills provision. So what can we do to support those people who are supporting learners to get online? I'll open that up to any panelists to jump in.
I think it's.
On you go, Alice.
Sorry, I was just going to say one of the things we're doing a lot more is actually collating resources, because I think particularly for organisations who are having to pivot, and it's building that confidence for people who are going to have to deliver virtual coffee mornings and are really worried that they're not going to give a good experience to people in their community. So what we're also trying to do is blend creating a place on our online centre's website for those resources, and also providing ongoing webinars for community organisations about how to really do this, and sharing practice across between organisations.
Great.
I was going to say, get them involved as well, because we've had that conversation with a lot of community organisations at the minute and said it was exactly that. What do we say on a phone call with an older person when we're talking through how to use a device or motivate them? And I said it's get them involved in actually what's the need, what's the challenge, and let's pull together that training effectively and sharing best practice, I suppose, like you say, Alex, bringing that tools and resources across the board, because every probably authority is tackling the same challenges at the minute, especially sort of supporting people remotely.
Brilliant, thank you. And one theme that's come through quite strongly in some of the questions, particularly the ones we received in advance, is that there's one thing about supporting people to get online, but then it's about supporting those people to do different activities online safely. And so how do we address issues around safety for new learners, new users of digital technology? Christina, if you'd like to kick us off on that one.
Yeah, so what I'd say with this is there's some great resources available for practitioners to look at how to do this, and actually a really easy place where it's been pulled together in partnership with ourselves and with Good Things Foundation is the One Digital website, which we can pop into the chat. And they have a really good resource bank, including things on safety that came a lot from workshops with practitioners where they talked about what the challenges were and also what was working very well for them. So we'll point to that one.
Great. And Alice or Rachel, do you have any sort of specific examples of supporting people to learn about safety online?
It's really interesting because prior to lockdown, some of our community partners had said actually they start introducing it earlier on in the conversation, because it's about wanting people to do more, and people get very comfortable with doing certain things and then are very worried about, for example, online banking. So if you can very simply give advice about passwords or about what are trusted sites at the beginning, and you kind of then hook them, as Rachel talked about, in stuff that interests them, there's the chance that not only they feel safe doing what they're comfortable with, but they feel safe doing more.
I was going to say peer support as well. So kind of where with the digital champion training that we deliver, obviously we do talk about online safety in there. We've obviously signposted to Learn My Way and some other great resources around Age UK that have got some fantastic resources around online safety. But I think the best people to support other people with online safety is older people, when they are really understanding of it themselves, because it just takes that fear away. I think from kind of our level, sort of almost supporting them through online safety, I think it's really good that peer support as well, when they are confident to access things like online banking. I think when they can see it from experience, it's got a really, really great impact.
Yeah, really, really helpful reminder there, Rachel, that peer support is a really important way in which we can support more people to get online. And of course, you know, there are lots and lots of people in later life who are using digital technologies and have been for a while and are really strong proponents of it. We're about to hear from one towards the end of today's session. So those people in our communities are also massive assets in supporting other people to be online and stay online safely. I've had quite a practical one come through, which I just think is really interesting. It's something that's been playing on my mind, actually, thinking about how do we do all these fantastic initiatives in this remote world, which is, you know, this kind of support that we often talk about giving people to get online is about sort of one-to-one support at their own pace, at people's own time, that's sort of enjoyable and sociable. Practically, give us a couple of examples of how we've delivered that same sort of support, but remotely. So I think both Alice and Rachel described some examples, but give us a little bit of an idea of what that looked like in real life. If I can get Alice maybe to go first on that one.
I think one thing that's been most successful is people always came in for a cup of tea or coffee to community centres, and so having a slot like 10 o'clock on a Thursday morning, and it's your virtual coffee morning, because if people have been shielding and they haven't had that contact, and it's a reason to get comfortable with video calling or with Zoom, and then something that you might do with family, but it's within that setting. It's not an expectation of doing anything particular. It's just a kind of chat, and it's just seeing a face. So that's been one of the most successful things that most of our community partners have talked about.
Brilliant, thank you. And Rachel?
Yeah, and I think sort of piggybacking on the virtual coffee morning idea, actually thinking about what sessions, what is the virtual offer? Because again, going back to kind of that hook, actually having sort of like show and tell sessions. Actually, one of our community organisations did a virtual session on online safety and just scams in general. So obviously we know that, you know, staying safe isn't just online. There's telephone scams and face-to-face. So actually that engaged really sort of new service users to the online world, the virtual session, because of the theme of it. So I think really varying the theme across the remote delivery and just sort of putting it in normal language. Zoom is what is Zoom to older people. We say Zoom, they say, oh, we're going to off to space. It sounds like we're going galactic. So I think just saying we're going to chat to each other, we're going to catch up, and just put it in normal language. I think we're so easy to say, do you want to join a Zoom call? And it just sounds like something out of this world, literally. So I think, yeah, just keeping it basic, avoid the jargon, which is obviously kind of working with older people, but I think it's very easy. We're all saying Zoom like it's a word that we're all very comfortable with now, but I think just bearing that in mind.
A really helpful reminder. I think our vocabulary has all evolved, hasn't it, in the past few months, and it's always worth remembering that sometimes these jargon terms can slip in and be quite unhelpful and off-putting for people. So another theme that's come through today quite a lot is around understanding success. So one issue is that quite a lot of statistics that are available about the numbers of people online are available nationally. So how at a local or a borough level do we know that we're doing well, and how do you within Leeds and at Good Things Foundation and the people within your network, how do we understand whether initiatives are successful or not in supporting people? So maybe bring Rachel in first on that one.
For us, it's really having a sort of person's voice, really. So actually really encouraging those voices with the impact stories through sort of the COVID and pandemic. We've really been kind of wanting to hear what the challenges are and really still listening. So through the organisation, probably from our role, but really then showcasing those success stories and really sharing best practice. So when I talk about collaboration again, that's been really key. We've been sort of pulling our organisations who are supporting older people together to have like a working group through the pandemic to really kind of, sort of share best practice, each one slightly different stages. So really kind of harnessing that amazing success and sort of shouting about it really as well. When we talk about investment and funding and the future, if we're not shouting about the success and sharing those case studies, there's a risk of where the rest of the funding is going to come from. So I think it's really, getting sort of the case studies under the right noses and really harnessing those success stories and getting them into the right places. But just really, showcasing the amazing work really and sharing best practice.
Brilliant, thank you. And Alice, I know this is your bread and butter, so any tips from you?
I think Rachel's just spot on, because stories are what hooks people. And so Devices.now has been one of the ways in which actually we've heard directly from people about the impact that it's had to have suddenly connectivity in their home and someone's setting you up and supporting you. And I think the fact that we've been able to promote and share those at a national level, and we've given evidence to select committees, we were also really keen that it doesn't become just a kind of evaluation exercise, an impact heavy exercise for community organisations, particularly at this time. So what we've tried to do is ensure that it's something that also we promote through things like our COVID-19 response report. We got agreement from all of our funding partners that there would be no delivery targets during the first 3 months of lockdown, and instead we would tell the story of what's happened. And actually across the board, funding partners were really happy to do that. They wanted the work to be affecting lives, and I think that has changed the debate as well with funding partners about what's important.
Great, thank you all so much for all of that. One thing that has come through, again, a very strong theme, was issues around accessibility. So how do we identify and access accessible equipment? One thing I can certainly recommend, and I've also seen it be recommended by one of our attendees, is to have a look at AbilityNet. They've got lots of fantastic resources on their websites. But just very quickly, if there's anything that any of our panelists have found particularly useful, a useful resource in terms of identifying accessible equipment for people to use, if you want to share that in the next minute, and then I will wrap us up from our question and answers. So unmute yourself as a signal that you want to jump in. Rachel.
Couple of things. So I know I mentioned in the presentation just where I'm working with the experts in those fields. So one of the big things around accessibility for both people in Leeds with learning disabilities and people with sensory and visual impairments was very much working with those organisations to pull together tools and resources that are accessible. So one of the resources, Be My Eyes, was fantastic for visual impairment. You may have heard of that. That's on our website under our tools and resources page. Supporting people remotely via TeamViewer as well, so you can screen share. But actually, I think really it's been thinking kind of around, really, like say, using AbilityNet, but looking at the really sort of basic changes you can make to the devices. So using styluses, when they first came out, they were everywhere, and then now they've suddenly disappeared. So we were conscious we've got lots of those available, because that just makes such a difference, rather than the some just sort of touching the touch screen that actually comes with a stylus. And even cases as well. We found sort of really slimline cases, the iPad cases or tablet cases, because the power buttons on the side, all the people have been holding them like this and clicking them off, and then obviously the screen goes black. So actually cases with handles as well have been great. Think about the physical accessibility, but definitely kind of the internal accessibility and modifying the devices using AbilityNet is really key. But on our website we have put some tools and resources where you can sort of maybe look at some accessible resources for different demographics and cohorts of audiences.
Wonderful, thank you Rachel. And Evidently, you're providing lots of useful information. We've had a request to clone you and put you all across the country to help us all do fantastic work in supporting people to get online. So I'm going to unfortunately have to wrap up question and answers there. I think we could go on for hours, but we can if we carry this conversation on Twitter. So please do continue the discussion, the thoughts on #RoadToRecovery. I'm also going to make a plea. I'm putting my comms colleagues who are sort of in the background on this webinar on the spot here and make a plea to share some of the fantastic resource and insights and examples have actually been shared between participants during the Q&A today. It's been fantastic to see all these different examples of what different people are up to across the country there. So we'll find a way of pulling that together and sharing with all of you somehow. So I'm sure you'd all like to join me in thanking today's speakers, Christina, Alice and Rachel. I'm going to give you a clap because no one else can. And today's webinar is the 4th webinar in a new series to explore what the road to recovery might look like for us all. And if you'd like to check out any of our previous events in this series, they're all on our YouTube channel. And a recording of this webinar will be joining those other recordings on our YouTube channel. So please do check it out. Also pop on our website and also Good Things Foundation and 100% Digital Leeds to see more about the work that we've talked about today and all of our research and reports. I'm now going to have one last shot at giving Marie the floor and closing with why this is such an important issue and why there are so many of us here today trying to think about how we can support more people to get online. So Ellie, if you're able to put up Marie, we'll close with her video.
Well, it's been amazing for me. It's been a revelation, really. It's so lovely to be able to talk to people and actually see the faces. And to see people, quite a few people at the same time, and get to know people better and find out what their interests are and learn a lot about them, really, that people have talents that you never knew of, and to be able to give other people ideas and show them things that you like, and maybe even they'll take up some of your ideas. And then there's been light-hearted parts where we've joked and laughed, and then more serious parts where we talk about this present situation and how it's affecting us. So yeah.
Brilliant. A lovely closer from Marie. And so it just leaves me to thank everyone for joining us today. I've certainly increased my body temperature by about 15 degrees during this presentation. So time for us all to go and get a cold drink and cool down. Thank you everyone for joining us. Have a good day.